today's podcast in the car with me, ELVINIA EDLYN, and I'm a year 1 medical student currently studying at University Malaysia Sabah. So, in today's podcast, we are going to explore into the world of anesthesiology. So, let's get into it! Anesthesiology is a medical specialty which focuses on the patient care during, after, and before the surgery. So refer to the slide, anesthesiologists are doctors who are trained in anesthesia and pre-operative medicine. They are responsible for 4 things. The first one will be pre-operative evaluations, creating an anesthesia plan, pain control, and also post-operative care. Next, we're going to dive deeper into the ocean where we talk about the system involved in this particular specialty, which is the cardiovascular system, the respiratory system, and also the nervous system, which is the most important one. Let's go! The first systems involved I'm going to talk about is the respiratory system. There are 3 main functions of this system. The first one, it provides for gases exchange, which includes the intake of oxygen for delivery to the body cells and also the removal of carbon dioxide produced by the body cell. And second one, it helps to regulate the blood pH by homeostasis. And the third one, it contains receptors for the sense of smell, filters the inspired air, produces vocal sounds, which is phonation, and also excretes small amount of water and heat. So basically, this system contributes to homeostasis by providing for the gases exchange between the atmospheric air, blood, and tissue cells. And also there are other 2 more functions. This respiratory system consists of the nose, pharynx, which is the throat, larynx, our voice box, trachea, the windpipe, bronchi, and also lungs. Functionally, the respiratory system consists of 2 parts. The first one would be the conducting zone, consisting of a series of interconnecting cavities and tubes, both outside and within the lung. The second one is the respiratory zone, which consists of tubes and tissues within the lungs where the gas exchange occurs. The relationship between the anesthesiology and the respiratory system involve both the conducting and respiratory zones, but it primarily focuses on the conducting zone. So the conducting zone, the main role is to transport the air to the lung. Anesthesiology is more involved with this zone because 1. For the airway management, for example like intubation, the use of a laryngeal mask, airway, or known as LMA, or also other devices, ensure the airway is patent for ventilation. The second one is the protection of the airway, which will prevent the aspiration or obstruction occurs in the conducting zone. And last but not least, the ventilation control, where air is delivered through the lungs to the lungs via mechanical ventilation and pass through the conducting zone as well. Meanwhile, the respiratory zone more into parts where the gas exchange occur. While not directly managed, the respiratory zone is indirectly supported in the anesthesiology. The second system that I'm going to touch on is the cardiovascular system, which is responsible for transporting blood throughout the body to deliver oxygen and nutrients while removing waste products. It consists of the heart, blood vessels, and blood, working together to maintain the homeostasis and support various bodily functions. So the effect of anesthesia on the cardiovascular system is divided into a few types of anesthesia. The first one would be the general anesthesia, where the most anesthetic agents can depress the heart function and lower the blood pressure by reducing the myocardial contractility and causing vasodilation. For example, like propofol and inhalational agents. The second one is regional anesthesia, where the spinal or the epidural anesthesia can block the sympathetic nerve, leading to the vasodilation also, which decrease the venous return and hypotension. And the last one is the local anesthesia, where high doses or accidental intravenous injection can lead to the cardiac toxicity, arrhythmias, or even cardiovascular collapse. Second point I'm going to talk about is the cardiovascular monitoring in anesthesia. If you can see in the slide, there are three pictures I've labeled HR, SpO2, and BP. So basically, anesthesiologists continuously monitor cardiovascular parameter during surgery to prevent complications. Cardiovascular emergency in anesthesia. The anesthesiologists are trained to manage life-threatening cardiovascular complications, such as the cardiac arrest, which requires immediate resuscitation, or known as advanced cardiac life support. Next is bradycardia or tachycardia, which address with drugs like atropine or beta blockers. And we also have hypotension, which is treated with vasopressor, for example like EDWIN and phenylphrine. Anesthesiology ensures stable cardiovascular function post-surgery, particularly in the patient with underlying heart condition or those undergoing major surgery, for example like cardiac surgery. Anesthesiology uses specialized techniques like cardiopulmonary bypass, which control the heart rate and also the blood pressure precisely. Anesthesiology directly affects the cardiovascular system of a person by modulating the heart function, the vascular tone, and also the blood pressure. So here, the anesthesiologist will play a critical role in ensuring the cardiovascular stability, particularly for a patient who is in the pre-existing condition or during the high-risk procedures. The last system will be the nervous system. The nervous system regulates body activities by responding rapidly using nerve impulses. The nervous system is also responsible for our perceptions, behaviors, and memories, and it initiates all voluntary movement. The nervous system is one of the smallest and yet the most complex out of 11 body systems in a human. So it consists of two, which is the CNS, central nervous system, and also PNS, peripheral nervous system. We'll start explaining with the CNS. The first point will be the ANS, or which indicates the autonomic nervous system. The medulla oblongata regulates the vital functions like breathing, heart rate, and also blood pressure, which anesthetics can suppress. Hence, anesthesiologists carefully monitor and manage this function. Second one is the consciousness and sedation. General anesthesia will target the brain, suppressing cortical activity to induce the unconsciousness. Drugs like propofol, sevoflurane, and opioids act on the CNS to block the pain perception and also the memory formation, or known as amnesia. And the last one, pain modulation. Anesthetics drugs reduce or block the signal in the spinal cord to prevent the brain from perceiving pains. So the regional anesthesia, such as the spinal and epidural blocks, interrupts the sensory pathway at the spinal level. Next, I'm going to talk about the PNS, peripheral nervous system. The first point will be the sensory nerve. Local anesthetics, for example like lidocaine and bupivacaine, it will block the sodium channels in PNS, which will prevent the pain signal from reaching the CNS. Meanwhile, the motor nerve, when the muscle relaxants act on the motor neuron to paralyze the skeletal muscle during injury, it will make making the procedures like intubation and abdominal surgeries possible. The third one is the autonomic nerve. The regional blocks can affect the autonomic nerve, such as in spinal and epidural anesthesia, which may lower the blood pressure by causing vasodilation. So, in conclusion, the anesthesiology relies heavily on the nervous system to induce the analgesia, sedation, or unconsciousness. That one is for the CNS. The nervous system also need anesthesiology for blocking the pain and motor signals. That one is for the PNS. Anesthesiology must understand the complex pathway of the nervous system to administer the right type and dose of the anesthesia, and also being able to manage its effect on the vital system. Allergic reaction and also this anaphylaxis disease are significant risks during anesthesia, as patient may expose to drugs and also substances that may trigger the immune system of that person. And this particular reaction can range from mild skin irritation to the life-threatening anaphylaxis. There are a few causes in terms of anesthesiology for this allergic reaction and also anaphylaxis. The first one will be medication such as muscle relaxants, antibiotics, and also anesthetic agents. And the second one is latex. The latex gloves or devices like catheters may trigger the reaction, particularly in latex allergic patients. And the third one will be additive or preservative. Additive in drugs such as sulfites or parabens may also cause reaction. Okay, so for the symptoms, they are divided into two: mild symptoms and also severe anaphylaxis symptom. For the mild symptom, it can cause on the skin urticaria or known as hives, itchings, and also flushing. In terms of respiratory, it will cause mild wheezing or nasal congestion. For severe anaphylaxis symptom, in terms of cardiovascular, it could cause hypotension and tachycardia. In terms of respiratory, it can cause bronchospasm, laryngeal edema, and airway obstruction. In terms of gastrointestinal, it can cause nausea, vomiting, diarrhea. In terms of neurological, can cause dizziness, confusion, and loss of consciousness. For the mechanism, which is IgE mediated reaction and also non-IgE mediated reaction. For the first one, it is subsequent exposure to the allergen because IgE antibody will bind to the mast cell and basophil, which will lead to the release of mediator, for example like histamine, prostaglandin, and also leukotrienes. For non-IgE mediated reaction, some reaction mimics the anaphylaxis but are not immune mediated, such as those caused by thyroid mast cell degranulation. Well, that's it in today's episode of Podcast in the Car. We'll see you again next time. Thank you for watching. Open for ya, oh.